Hello,
Hi.
my name's Georgia. I'll be a student naturopath for today. What is your preferred name I can call you by?
Marie.
Marie, no problem. So Marie, have you ever seen a naturopath before?
No information.
No worries. So Marie, today we will begin our session with me questioning you about what's brought you in today. I'm going to do quite a thorough review of different body systems in order to formulate the best treatment plan for you in line with your goals and the best evidence-based practice available. Naturopathy is a holistic method of healthcare, so we will be looking at you as a whole, hence why I'll be asking you so many questions. So everything that we speak about today will be confidential, aside from me talking to my student supervisor, and in the odd event that you are at a risk to yourself or others, I will have to escalate to the relevant parties. Is that okay with you?
Yes.
Yep, no worries. So with your treatment plan in mind, do you have any cultural, social or religious factors I need to be mindful of when working together? For example, use of animal products or alcohol in your treatment?
Oh, yes. I am pregnant.
Yep.
I can consume animal products, but I can't consume alcohol.
Yep.
I have no allergies and I'm a non-smoker.
Okay, thank you for that. No worries at all. So Marie, if at any time you have any questions or want further explanation on my treatment, please just speak up and let me know. I'll be typing on my computer to write down your answers, but you do have my undivided attention.
Thanks.
So, in saying that, what's brought you in today?
Heartburn in pregnancy.
Okay. In terms of that heartburn that you're experiencing in pregnancy, where would you say you're mainly feeling it?
In the middle of my chest and into my throat.
Middle of your chest and into your throat?
Yeah.
And how long have you been experiencing this heartburn for?
It began before I realised that I was pregnant. I'm sensitive to smells and picky with what I eat. What was your question, sir?
When did this start?
Oh. Yeah.
Yep, okay, no worries. And how far along are you in your pregnancy now?
I am 12 weeks.
Okay, so you've been experiencing this heartburn for a little longer than 12 weeks, mid-chest into your throat. Now, is there any things that make it better or worse that you've noticed throughout the last few months?
Chocolate, peppermints, fatty and acidic and spicy foods, and eating too much or laying down after eating, and stress also makes it worse.
Okay, chocolate, peppermint, spicy foods, acidic foods,
And fatty foods.
and fatty foods. And eating too much, you were saying?
Yeah, or when I lay down after I eat, or if I'm stressed.
Okay. And what about what makes it better?
Zantac.
Yep.
And also has helped me to reduce the frequency.
Yep.
And also eating a bland diet and avoiding the trigger foods.
Yeah.
And sometimes just waiting it out. It takes about an hour to go away.
About an hour. No problem. And in terms of the quality of that heartburn you're experiencing, could you put words to that?
Burning, uncomfortable feeling in my chest that lasts for 20 minutes after eating something that triggers it.
Okay. No worries. And does that pain or that uncomfortable burning feeling radiate anywhere else in your body?
I get food regurgitating back into my mouth for 2 hours when it's severe.
Regurgitating for 2 hours. Okay. And in terms of that severity, could you scale the pain for me? 0 being no pain, 10 being the worst pain you've ever experienced.
It's a 2 to 3 since the Zantac, and before that it was a 6 to 7.
And what could you tell me about the timing of this heartburn that you've experienced?
Generally it's once per week with breakfast. It's with most lunches and with every dinner. But before the Zantac, it was after everything that I ate.
Yeah. And in your own understanding, how do you feel about what's bringing this on?
I feel like it's just a natural part of pregnancy. And I just hate taking prescription drugs.
Okay, so the goal would be to get off those Zantacs, it sounds.
Yes, I would like to advise on how to manage my heartburn through diet, as I would like to reduce the medication I'm on.
Yeah, that's great. No problem at all. So we're going to have a quick look at a few body systems now so we can get a deeper understanding of this heartburn.
Okay.
So in terms of your digestion, so since you've been pregnant, have you noticed any changes in your bowel motions?
My bowel motions have become slower than usual in the last 5 weeks. I was previously going every day, but now it's more like every second day.
Every second day. And I'm going to show you a chart. And I'm going to ask you to point to which bowel motion you feel resonates with what you're experiencing.
Probably number 2 or 3, because my stools are mid to dark brown. They'll be hard to pass and formed, and there's no undigested foods.
Thank you for that. And are you experiencing any gas or any bloating?
I don't generally get bloating or gas.
And this is the first time you've experienced heartburn, is that right? You haven't had heartburn in the past?
Until pregnancy, I didn't get heartburn or reflux.
Okay. Thank you for that. So I noticed on your intake form there was a few symptoms that were popping up in terms of your renal or your urinary system.
Okay.
So we're going to touch base on that now. How many times a day are you urinating?
I urinate 6 to 7 times a day, and more when I'm anxious.
Sorry, won't be a moment. Six to 7 times per day,
Yeah.
more when anxious.
Yeah.
And what about during the night when you're sleeping?
I need to get up 1 to 2 times per night to urinate.
And with urination, are you experiencing any burning or any discomfort on urination?
There isn't any pain, but there can be a bit of dribbling when I sneeze or cough.
Dribbling when sneeze or cough. Do you have any past medical histories of any urinary infections or urinary tract infections?
I've had UTI since my 20s, and
Yeah.
my last one was 7 months ago.
And-
I started with needing to urinate frequently, and when I did urinate, I had a feeling that I needed to pass more.
Yep, so that feeling of not being able to empty it properly, empty your bladder properly or fully. Okay. And in terms of your ability to hold your urine, you were saying that you get some dribbling when you're sneezing or coughing. Do you experience any increased urgency when you're out, or like anxiety around not being able to make it to the loo?
I get a bit anxious about needing to urinate, so I'll go about 3 times in the morning before leaving for work. And I'll go to the toilet wherever I get somewhere just as a precaution.
Okay.
When I'm anxious, I need to urinate more.
Okay. Alright. And in terms of this anxiety, so we're going to look at your neurological system now.
Yep.
To what extent do you experience any mental health complaints like anxiety, depression, or stress throughout the day?
In regards to depression, I had a bout of depression about 6 months after I injured my shoulder, and I think that accident really affected me, and since then I haven't slept well, and this has affected my moods. I started having anxiety attacks in 2016. I would get stressed about something, then I would get hot and my heart rate and breathing would increase. I startle easily and I've learned to calm myself down. I haven't had an anxiety attack for 6 months.
Okay. And in terms of how you're feeling throughout the day, do you get any lightheadedness, tingling in the hands, or headaches throughout the day?
I get regular headaches due to shoulder and neck stiffness, and the pain is in my temples with light sensitivity and nausea. They come on during the day and may last all day until I go to bed. I've had those since I hurt my shoulder.
Okay. And are you taking anything for those?
No information.
No information. That's all good. So the only medication that you're taking is that Zantac that you were saying, the antacid?
I also take a Blackmore's Pregnancy and Breastfeeding Gold.
Okay. How often do you take that?
2 tablets with breakfast.
And when was the last time you saw your GP?
I saw my GP about 6 weeks ago.
Okay. And what was that for?
Heartburn and a pregnancy test. And he prescribed me the Zantac and the pregnancy multivitamin.
Okay. And do you have any allergies or intolerances that I should be aware of?
No.
Thanks for answering that. So now we're going to have a quick look at your medical history.
Okay.
So I'm going to ask you questions from different stages of your life. They're all relevant and will help with with your presenting complaint, but they are quite specific. So if you could recall throughout your life, I'll go through the stages with you, but any major hospitalizations or massive life stresses, or any major illnesses, let me know. So we'll start from around birth to 5 years of age. Do you remember or have your parents told you anything about that stage of your life?
Yes, I was a vaginal birth. I was breastfed for 6 months. And in that time, I had recurrent ear infections, which seemed to resolve by 4 years, and I'm fully vaccinated.
What about your primary school years, so that's 6 to 11?
NA, pretty healthy.
Okay. 12 to 17?
NA.